child is autistic. And the moderate, there is still a little balance. And but the severe, it is actually, there's an obvious characteristic of the child being autistic. And also, causes of autism, as I said, that there is no specific cause for autism yet, but there are risk factors for autism. For example, genetics. For instance, if there is a time, like there is a generation, maybe the great grandfather or something, and actually had someone with autism, there's actually a very slim chance of the child having autism. The parents might not have autism, but it might be in the recessive gene of the parent becoming dominant in the child. That is not a cause, but a risk factor. And also, when the mother is actually exposed to some kind of chemical when she was pregnant and all, it can actually be a risk factor for autism. So some characteristics of autism: one, we have repetitive behavior. You would have actually studied in your child at one point or the other that this child just likes doing this thing. Like, no matter what, if it's like rolling of tires, the child loves it. Like, that's only what he or she wants to do. Like, that's a repetitive behavior or activity a child with autism can actually display. And also, you can discover that your child loves flapping his hands or playing with their fingers every time. It is actually an example of a repetitive behavior the child can actually display. And also, they are also sensitive to things around them. For instance, lights, sound, and texture of your clothes. So at our clinic, whenever a parent comes and before we diagnose the child of autism or any speech-related cases of autism, we actually ask the parent that one of our questions is that when there is too much light or there is a noise, how does your child react? Because there are most times when there is like a crowded area like this, they just close their ears and feel uncomfortable around that situation. So that's one characteristic that you can actually look out for in your child. And also, they cannot maintain eye contact. For instance, if you are trying to look them in the face, they just take their eyes away because they can't maintain eye contact with you. And again, from childhood, you might not actually figure out that your child is autistic until you take your child to a professional. You might just see that your child's development is a bit slow. He's not talking at that point that he's meant to talk. He's not understanding what you're saying at that time. Some people just be like, my child is 3-4 years, he's not saying anything, and his age mates, they are even talking, they are even reading, but my child is not doing anything. It is actually nothing to worry seriously about. It's just that the child has a delayed development than his regular peers. But with the right professional coming to play, that development or that stage would actually be achieved, but in a later scenario, like in a later day. So professionals that you need specifically for your child with autism, one is a speech therapist. So a speech therapist actually helps with your child communication. And communication in the sense that we have two types of communication: verbal communication and non-verbal communication. Verbal communication is where you can say, how are you? I am fine. Do you want to eat? Yes, I can. And non-verbal communication is gestures, facial expression, and also sign language. So the child actually does not have any understanding of all this before being brought to the speech therapist. So the speech therapist actually helps enhance that child's communication. We have two different types of autism: non-verbal autism and verbal autism. Non-verbal autism, they can't actually express themselves with words, like most of the time. But verbal autism, they can actually express. Even with speech therapy, they will be able to. But for therapy for verbal autism, they'll be taught like different words. They'll be trained over time to be able to use specific words to express themselves. And non-verbal autism, though, there is something called alternative augmentative communication, whereby there will be other means of communication that can be adopted for the child to be able to communicate his thoughts or ideas to you. And also, and one more thing about the speech therapy. One thing we tell parents is that when we start speech therapy for your child, it doesn't mean in the next 1 year your child will talk. Because this has to do with the brain. We are actually kind of resetting the brain back to the way it should be. So it's like we are starting all over from the beginning. So one thing we tell parents is that they should be patient for their child to get this goal. It is not that your child, after 1 year of therapy, you'll be like, we are going 1 year, this is almost 2 years. The child is not even saying, Mommy, I want to do this. The child is not doing what you want. It is stage by stage. And secondly, you need an occupational therapist. Why do you need an occupational therapist? This is to help train the child how to do day-to-day activities. Like before the therapy, they may not be able to use the toilet, take their bath, but an occupational therapist would train them to do those things. Okay, when you feel pressed, you go to the toilet. When you want, if you want to help mommy in the kitchen, this is what you can help her to do. How to carry day-to-day activities. How to not to be dependent on people a lot, but to actually create their own independence. And thirdly, we have the behavioral therapist. A lot of children with autism actually display tantrums. Yes, because one, that's how they are neurologically, should I say, developed, and also they can't express themselves in a certain way, so they feel that's the only way you can actually get attracted to them or get attention. So they throw tantrums, and also they cannot understand social cues like turn taking, that wait, it is not yet your turn. It is this person's turn. After this person, then you would do yours. So a behavioral therapist actually helps them with that. It helps them to learn how to understand people's facial expression, when this person is sad, when this person is angry, or when this person wants you to do something. So that's where a behavioral therapist come in. And also, one thing I would actually advise parents with children with autism is that acceptance actually starts from you. If you don't accept the child, nobody would accept the child. It is what you define your child that everybody will define the child with. So I understand, because one of the first expression parents get when their child is diagnosed of even anything is that, with it, like I want to give birth to a doctor that after kidney, so will this child still be a doctor? Yes, the child might not be a doctor, yes. But there is something else the child is meant to do. There is a way the child can have impact on the society. And that is the way you should tread on. And one thing I will also tell you is that after diagnosis, you should actually, limit your expectation for the child. So one example I would like to give was when we had a patient whereby after the diagnosis and all, you could actually see the reaction of the mother, and she was a bit confused and all. But we had to actually tell her the benefits of the speech therapy and all. And I understand that financially, it might actually be you can actually be handicapped to do some things. But taking these steps would actually help your child meet those milestones, and if not even walk at the pace of his or her peers, but achieve that thing at the end of the day. So, I have a question. If you've met any professional, whether a speech therapist or a behavioral therapist or an occupational therapist, please can you signify? Okay, thank you so much. So now I would advise for you to meet any of these professionals. It is going to really, really help you. And even before you go there are things that you need to do. One thing you need to know is that you are the expert. You know your child. That does not mean you should argue with the professional that, mommy, I understand my child more than you can. But it is that you should make sure that your opinion, your ideas is actually being bought by the professional. You are not sidelined and the professional is going all the way. Because we tell parents that our own job is 40%, the parent's job is 60%. If you want progress for your child in this therapy, it all depends on you. We can go for therapy for 3 years and this child still remains the same if you don't do your assignment. So the first thing you need to do when going for an appointment with a specialist is that you take every necessary document that you've acquired so far. Maybe the antenatal, like everything, you must be ready to take it along so you won't be lost. And secondly, you must ask questions. Don't just keep yourself. Nobody's an island of knowledge. You ask questions so that you can know better, because you've enrolled in a school of life. You've enrolled in another school. So you must learn how to ask questions and you must be open, because there are a lot of parents that just come. They don't say specific things, and at the end of the day, even while we are trying to confirm if it is autism or not, we feel that this parent has held back a few information from us that is keeping us in the dark. So you must be open so that we can find solution to anything you bring. And one thing about our job is that there is confidentiality. We won't tell any other person your problem, even if you bring your friend, we will tell your friend to stay outside so that you can be free to tell us everything. Oh, I feel like this is what happened and this is what happened. Then we can give a right diagnosis and all. So finally, I just want to tell you all that autism or any special need is not a disease. It's not something that you need to run away from. Everybody has a disability, if we can say, or a disorder. I do have one. I'm wearing glasses. So everybody has a disability. Anybody that says they don't have, they need to check themselves, because there is a place that you cannot function well. There are places that you cannot achieve what others are achieving. So being autistic does not mean you. It's not ishiaye. It's not that somebody caused you anything. It is you coming to give life a meaning. That's just it. So thank you so much for listening to me. Thank you so much. I really appreciate it. Thank you.